Let's talk about cervical cancer and its prevention. I am Dr. Nadeem Sajjad Raja. Approximately 1 in 142 females in the UK will be diagnosed with cervical cancer in their lifetime. This equates to about 3,000 women each year, with the most common incidence occurring between the ages 30 to 34 years. Unfortunately, there are around 850 cervical cancer deaths every year in the UK. To reduce not only incidence of this cancer, but also reduce mortality from this cancer, understanding ways to prevent cervical cancer and awareness of symptoms is extremely valuable. What are the common signs and symptoms of cervical cancer? To identify cervical cancer early, awareness of the signs cancer be really helpful. Here are a few things to look out for. Irregular vaginal bleeding that is unusual for you. Postmenopausal spotting or bleeding. Bleeding after sexual intercourse. Changes in vaginal discharge. Pain or discomfort during sex. Pain in your lower back or pelvis area. If you are experiencing any of these, talk to your GP or practice nurse. We know this is a sensitive topic, but your healthcare professional should be supportive and understanding. How cervical cancer be prevented? Best ways to receive human papillomavirus vaccine offered to children aged between 12 to 13 in the UK, as well as undergoing screening to identify abnormal cells before they develop into cancer. Other precautions are use condoms. They reduce your risk on contracting human papillomavirus, though as they don't cover all the skin around the genitals, you are not fully protected. Quit smoking. Smoking lowers your immune system, which increases your risk, as well as certain chemicals in cigarettes are known to cause cervical cancer. Eat a healthy diet. This aims to optimize a healthy immune system. Cervical screening or smear test is important. The abnormal cells are picked up and early diagnosis is crucial to control the disease. Cervical screening is offered to women between the ages of 25 to 64 years in the UK. Please subscribe my YouTube channel and press the bell icon button so you will receive all new videos. I'm Dr. Nadeem Sajjad Raja. Thank you very much for watching this video.